I'm Sarah Cummins of Waterfall Yoga, and I'm here with my friend Angela Etkin of Soothing Aesthetics in Wichita, Kansas. We're so glad that you've joined us for this pelvic health and wellness series for men and women. The pelvic floor is the base of our core, and any function or dysfunction that it has affects our movement as well as all parts of our physical body. So it's really a key component when we use breath work from our yoga practice to affect the pelvic floor. We also will be using the movement portion of this series in order to soften, strengthen, and stretch the pelvic floor. So my pelvic floor dysfunction is both hypertonic and hypotonic. And I discovered this not from the many different diagnoses that I was getting from physicians, or rather misdiagnoses, by taking yoga therapy courses and discovering that this dysfunction in my pelvic floor had been the cause of my pain for many years. So what was able to help me heal my pain and heal my pelvic floor dysfunction was the practices that we'll be teaching you in this 5-week series. So I hope you enjoy it. Make sure you read all of the information about the anatomy, the musculature, and the functions of the pelvic floor, and also some of the symptoms and diseases that show up, because sometimes that misdiagnosis comes from the referred pain. So rather than looking specifically at the pelvic musculature, you might have pain in your low back, tight or painful glutes, tightness or pain down the legs, and even digestive issues such as IBS. So make sure you take a look at all that information in this series as well as taking these classes along with us. And be sure to modify and use any of the modifications that I'm showing you in this series.